Now we're going to go from understanding viruses and your immune function to how you can upregulate your immune system. Your immune system is a very complex set of cellular signaling molecules that are interacting with each other on the fly in response to these infections, and they need certain cofactors to function properly. I'm going to go over the specific value of the ones that I've found to be most valuable. It's vitamin C, vitamin D, resveratrol, zinc, magnesium, and melatonin. Let's get started with vitamin C. Vitamin C is a very potent antioxidant, and it's also critically important for both innate and adaptive immunity. We talked about this before. In the innate response, it helps with that phagocytosis process we talked about, and on the adaptive, it helps with antibody production. They've also found in multiple studies that vitamin C supplementation decreases the duration and severity of respiratory illnesses. There are some nuances to it, however. They have shown that you want to keep a continual serum level in your body to get its maximum effectiveness. And at the lowest dosage, 250 to 350 milligrams a day. Vitamin C deficiency is the fourth most common deficient vitamin in our diet due to low intake and low body stores. But the other caveat about that is if you're sick and you're in an ICU, you may need in the gram level for it to be effective because of the excessive inflammation and the excessive metabolic demands. But vitamin C is critically important. I personally take between 2 to 3 grams per day, and that's what I recommend to my patients. That way you're getting enough in your body that if you do get sick and you have high metabolic demands, you have that ready to go. Next, we've got zinc. Zinc is also critical for innate and adaptive immunity, but it's also a very potent membrane stabilizer and helps with free radical oxygenation damage. When you have a major infection going and your body's putting out a bunch of inflammatory mediators, you're spilling things called free radicals, and free radicals is what causes cellular damage. Anything we can do to help with that is a good thing, and zinc does that. I recommend 50 milligrams at least a day. That's what I take, so make sure you're taking your zinc. Next is vitamin D. Vitamin D is also very important for innate and adaptive immunity. It's also been shown that people that have severe infections very commonly have low vitamin D. It's very common for us to have low vitamin D due to low exposure in the sun and low intake in our diet. So that's also extremely important. I recommend taking at least 1,000 milligrams, but more like 4,000 milligrams is what you should be taking every single day. There is some theoretical concern about toxicity with this, but you'd have to take 50,000 IUs a day to worry about it. We're not anywhere close to that. Moving on to magnesium. Magnesium is also important for modulating your immune system, but what's more important is that it's key to the absorption and the functioning of all the different enzymes of vitamin D. If you don't have adequate magnesium, you're not going to have adequate functioning of your vitamin D. So not only does magnesium have direct positive effects on your immune system, but it's critical for vitamin D absorption and utilization. I recommend 400 milligrams per day of that. Next, we're going to talk about resveratrol. Resveratrol is a very interesting compound. It has been shown to have direct antiviral effects. In a study, they studied the MERS coronavirus, which is the Middle Eastern respiratory virus, and found that in vitro that it inhibited RNA synthesis. COVID-19 is an RNA virus. This is shown in test tubes to inhibit that, and that got my attention. What was also really interesting is that they did a study in piglets, and there's a virus called pseudorabies that infects piglets. 50% mortality in piglets. If you load them with 10 milligrams per kilo 7 days prior, they show 0% mortality. They had 100% survival after that. Now, has this been shown to be true in COVID? Nobody's going to volunteer for that study. But when I see those kinds of results as a physician, that really gets my attention. I recommend that you take 1,000 milligrams per day of resveratrol, and that's what I take every single day. Next, we're going to talk about melatonin. Melatonin also has direct positive effects on innate and adaptive immunity, but it also is key to helping with get good restorative sleep. So that is very important. So again, key ingredients to upregulate your immune system: vitamin C, vitamin D, zinc, magnesium, resveratrol, and melatonin. Very important. And this is something that you can start taking tomorrow. I've been taking it for years, and it's really important to help upregulate your immune system.